I'm learning a lot about how to control energy with my own dog. And she gets very excited and barks when she goes to the door, hears anyone around the house. And so now, rather than getting all upset and everything like that, I'm saying to her, Nicolette, change your energy, change your energy. But I realize she's also responding to my tone of voice as well as my energy. So I'm trying to make that transference with her. You said something earlier, though, that I'd like for you to get back to, and that was about anxiety. Can you tell us a little bit more about that?
Let me explain that. I'll go back a little bit with diurnal rhythm. Not everybody may know what diurnal rhythm is.
I'm one of them.
You don't? Okay, well, let's help. Let me help. We are predators. The human's a predator, meaning in the morning we're supposed to either go hunt or run from an enemy. Okay, some animals are not predators. The herbivore, the cow, etc. is not. But in our case, our cortisol is at a low level in the morning. It rises to meet this occasion, adrenaline, okay? Cortisol, adrenaline. Comes up, we hunt, we work all day. In the evening, when we go to bed, that cortisol has to come back down. If it does not, we have immune depression. Immune system's tightly related with high cortisol. High cortisol, low immunity. We want a 40% separation in this. Some of my first research went back to feedlot cattle. I worked with a lot of stockers coming in from, stockers meaning young, naive cattle coming off the cows into the feedlots of Nebraska, Kansas, etc. When they would come in, they generally walked the fence line for roughly 5-7 days, bawling. This is a real problem, sore throat, inhaling dust, so we get pneumonia, 25% illness, 2-3% death loss. Ranchers would come to me and they'd say, Doc, why are these calves in 36 hours not bawling? Why are they just content? Well, I said, they must feel good. Their immune system's up, they're happy. So I said, that's probably it, but I said, you got my attention. So I called a good buddy of mine, Dr. Bob McClung in Tiffin, Ohio. I said, Bob, I want you to buy 10 of the toughest calves you can find, meaning orphan calves at the sale barn, 500, 400-pound calves, and high-stress calves. And I said, I want you to put them on my product day 1, 2, and 12. I want bloods on those calves morning and night, and we're going to look at cortisol. I want to see what we're doing with this product. I used a BET laboratory, a diagnostic laboratory, and we took, I think, 192 bloods looking at cortisol, T4 function, insulin, and T3 function. Those are indices that we're trying to say, measuring stress. We corrected that stress roughly 46%, meaning we returned that diurnal rhythm that I'm talking about. That was the best piece of field research I've ever done in my life. Because what we're really talking about here, if we can manage stress, which we're doing with what we call Stress Pack, it's phenomenal.
You know what's so exciting to me is the fact that it's kind of like a shift. Because it used to be that we did a lot of animal testing, and thank goodness we're phasing a lot of that out. But with the animal test, now the humans are being test guinea pigs for the animals because we're using things like pacemakers and a lot of the technology that we've used for humans, now we're using in animals. Would you like to comment on that?
Yes, consumer demand. Consumer demand. If a guy has a pacemaker or a kidney, artificial kidney, he says, hey doc, why can't you do that? And it is the reason, you mentioned to me the other day in an idle conversation, you said, why is vet medicine so expensive? It's really because of this demand. Today, it's not uncommon for a veterinarian to buy a $150,000 x-ray unit so he can digitalize that picture and match anything that the human business is doing. We have a CAT scanner right next door in the practice I'm in Santa Cruz. It's the old one, came from Dominican Hospital. The client is demanding it. And that has driven the cost of medicine up, quite honestly. They weren't content with to put a pin in a broken leg. They said, not when I heard my buddy went to the hospital in an auto accident and had a Richard plate or whatever, a plate to put the bone together. Client asked for it. Veterinarian's trained to do about everything. And you give him the equipment, if he doesn't know, he's going to learn.
Isn't that interesting?
Sure. If the client wants it, he's going to learn. But that is one of probably the driving forces of increased veterinary cost, plus the cost of education and the cost of property to set up a vet hospital runs in the millions today.
Weren't you telling me that it takes about the same amount of money to go to veterinary school as it would to become a medical physician?
I would say yes. I would say yes. I think the average graduate today is coming out, I'm guessing, don't hold me to this, but easily $150,000, $200,000. And I hear med students, I have a daughter pursuing that now, and I see what her bills are. They're not far off vet medicine. I think it's the same length of education. The internships and the residencies aren't as demanding, but the specialties are. The specialties are asking for 2- and 4-year residency. So yeah, and we don't have insurance to help us. We don't have insurance to pay the bills on these animals, and so most of it's out-of-pocket change. There's some insurance, but it's not as generous, let's say, as some.
What is your feeling about vet insurance?
I don't know why it hasn't been used more. I'll be honest with you. I don't know why it's not used more. It could be that I don't think it's cost prohibitive. I think it's quite effective. Maybe there's some abuse going on in it. I really can't. I'm not good at answering that. I'm amazed that everybody doesn't insure their pet. But it hasn't taken off like it has in the human business.
Dr. Raemaker, you've talked to us before about genomes. Would you now talk a little bit about the relationship between genomes and humans and those of animals?
Well, I'm sure everybody read the article here about 6 months ago that they identified 70-some genomes identical from dogs to humans. And what I study is primarily swine in a lot of my research. I'm looking for genomic expression of these immune modulators that I work with. And there's over some 2,500 genome groups, whatever, identified in the pig. And there's in the area, and please don't hold me to these exact numbers because I don't have it in front of me, but I know there's 60 or 70 that are almost identical to humans. The human, for example, in the pig intestine is very closely related up to the first 21 days of birth. And so we're looking for genomic expression with these immune modulators in baby pigs because here's the reality of research. We can sacrifice a baby pig at various stages and understand what we're doing by stimulating the genome. We know what effect we can have on the T cell, the immune cell, and it's a good field of research that I hope someday will bridge into the human side. And this is some of the work that we're looking at.
What I find fascinating is a topic that you've been on top of for quite some time, and the media is catching on, and even Katie Couric did a piece on it, and that is the effect of the usage of antibiotics in animals and how that's affecting human livelihood and health care. Would you talk to us a little bit about that?
Oh, I get so passionate. You're going to have to lower the lights because this is one of my pet peeves. We, as veterinarians, this is my 41st year in large animal mixed practice. We find less and less effective antibiotics. And that goes for anthelmintics too. We're going to address that, I hope, in a little bit, meaning parasites. The antibiotics today, you wonder why have we got penicillin almost obsolete. Here we're looking at things like vancomycin, high-powered, expensive, and unfortunately many of them do have side effects. We have created a nightmare for ourselves by being so dependent on the antibiotics without addressing the root problem. The root problem lies at the base of the food chain. Right? Today there's hundreds of thousands of pounds of antibiotics going into our food chain, from poultry to farmed salmon to beef cattle. Beef cattle come into a feedlot. They're put on oxytetracycline as a stress antibiotic for roughly 21 days. That's not uncommon. Feeds on swine are almost carried out throughout with bacitracin, Tylenol, various antibiotics. Now, what happens in this process, I like to feel there's a certain amount of abuse. And I'll go into a little more of the science of it after I finish my point, is that we're going down a road that has no end. And I feel like I remind me of the little chinchilla in the cage going around that wheel. He never quite gets to where he wants to go. And that's why I feel we are with creating new antibiotics every day that are more expensive and knowing that the organism's going to build a resistance in the near future. And we're running out of silver bullets. So I address this with going back to my naturopathic type of work, coming up with immune modulators that come from nature. Many of them are derived from dairy colostrum, the first milk, the first 48 hours of milk that trains our immune system. Many of them are power glucans that we get from medicinal mushrooms, yeast cell wall. We know that these powerful immune modulators and balancing vitamin, minerals, amino acids, many of my products have up to 115 ingredients in them. Setting that profile correctly, I've been able to take a baby calf, a baby chicken, a turkey, a baby pig, from conception all the way to finish to processing with no antibiotics, more efficiently, less expensively, and saving the food chain, saving the environment, if you will. I think I could stretch the word out to saying the environment, because
and humans.
yes, I'm going to. I shared.
Life.
Yeah, I shared with you the research that the young girl
From the Hudson River.
Yeah, that took the senior in class took the science project, took the water out of the Hudson River, I think it was, and identified 15 or 20 different antibiotics in this water, and it was what people do is flush them down the toilet. Here they go. Now you say, well, so what? The problem. Can I get into the science with this? Is this okay with you?
Yes,
a little bit.
Yes,
well,
as long as you explain the terminology.
I'll do my best. I'll do my
Thank
best.
you.
A bacteria, let's take an E. coli, that might be traveler's dysentery. If you treat it and you just tap it on the shoulder like we do in stress antibiotics, that bacteria says, I know what you look like. I know what you look like. I know how to defend you. I survived you once. What unfortunately we found out is they have the ability to transfer this information to a salmonella, another bug, any of the vast array of bugs that are in the gut or anywhere in the body. They take what I think is called a plasmid transfer. It's like a little finger, inject their information into the DNA of the other organism, who's their cousin or what have you, and says, hey, next time penicillin comes on board, here's what you do to defend yourself.
Wow.
And that's scary. Now here's what's really bad. Viruses, we're finding, are the engineer or the architect of this transaction. And it doesn't have to take place in the body. It can take place in a cesspool. It can take place in stagnant water. Wow. And that's frightening. And I'm not here to scare the living daylights out of everybody that's going to be watching this or seeing this.
Well,
but
you just did me.
Well, let me give you good news then.
Thank you so much for joining us today. And we hope that you will check in again with us for part 2 of the interview with Dr. Raemaker.